Ladies and gentlemen, welcome this evening.
Thank you.
I would like to acknowledge our guest who is here. Am I not double miking? Should I give one of them? Keep both of them? Allow me first to acknowledge our guests who are here. I know, firstly, our guest of honor, Dr. David Mombeshura, the Minister of Health and Child Care, who was supposed to be here, represented here this evening. Allow me, of course, to acknowledge the Minister of Information Communication Technology and Courier Services, Dr. Matevera, who is here. Please give a round of applause for making it this evening. Allow me to recognize the members of Parliament who I know are here amongst us. My dear friend, Honorable Sheki Timburwa, is either here or represented or is on his way, the Member of Parliament for Chegutu West. Allow me to recognize my good friend, Honorable Naledi Machinga Maungani Zemadzara, the Member of Parliament for Mashingo. I know she is here again somewhere, or she is on her way. My good friend, the Permanent Secretary of Information, Publicity and Broadcasting Services. I see your protocol officer is here. I don't know if he is making his way. I know he was coming from China this afternoon and is coming from the airport, or was coming from the airport straight to here. Government ministers who are here, allow me as well to acknowledge the board members of Salutem, Dr. Kleto Masia, the guy who runs Rafa, Madam Rose Namo, and Mr. Valentine Mushayakana. The executive management of Salutem, the board chairman of TGI, Mr. Blessing Chimini, who is here, the board members again of TGI who are here. Board chairman of AFOS, I don't know if she is here, or rather he is here, yet Mr. Sia and Mr. Sanyang and Ms. Sanyanga, the CEO. The managing director of Salutem, Mr. Ruka Nyoka, and the and the various executives of Salutem who are here. In the interest of time, allow me to observe this protocol for all speakers who are going to come after me, so that if they do not repeat this protocol, please do not crucify them for not saying all your names again. Allow me, before I proceed, to acknowledge all of you, ladies and gentlemen, who are here, comrades, friends, and many familiar faces. My good friend, Dr. Mwaya, who is here, the CEO of Geo Pomona, Washington, the CEO of Elion, and many of you who I shall not mention by name. I just wanted to say, ladies and gentlemen, that it is not a coincidence that we've called you here today. Today is the 1st of August. It's the beginning of a new season. It's also the beginning of spring as we know it. When I left my house this afternoon, my dear friend, my gardener named Petros, was busy cleaning up leaves, never-ending leaves from the driveway. They are annoying. But at the same time, we know that when the leaves are falling, that is the beginning of something that is great to come. Spring, the beginning of summer, where we're going to experience the beauty of the jacaranda, and we're going to experience something that we believe is incredibly great. We hope equally that this is the beginning, today is the beginning of something that we believe is going to be revolutionary within the healthcare service. And we believe that in this revolution we are going to experience a change in what we've seen between the partnership and provision of healthcare services, and also the role that private healthcare insurance companies have taken in addressing some of the challenges, or not taken in addressing some of the challenges that we have experienced as a country. Healthcare in Zimbabwe, as many of you know, is led by the national level governance framework that is founded on Section 76 of the Constitution. which guarantees health as a universal right for each and every Zimbabwean. And the Constitution, of course, is supported by the National Development Strategy, as you know, National Development Strategy 1, which seeks, among other things, of course, to improve primary and secondary health care and enabling environment for healthcare services delivery, improving access to essential medication, domestic funding, and the quality of life, again, for each and every Zimbabwean. The public sector, as you know, is the major healthcare provider for at least 90% of the population that is not covered by medical aid. And the major domestic funding sources that includes the government through budget allocation through the fiscus and allocation through local authorities, households, non-governmental organizations, and private companies. But despite these efforts, we know that there are many challenges in the country, and we know that many Zimbabweans are suffering financial hardships with no equitable access to healthcare due to inadequate and unsustainable, and in many instances, inefficient funding of the healthcare sector. And to a large extent, because of the limited participation of the private sector in how we are funding healthcare. Whilst there's been significant progress that is made in reducing terminal diseases such as HIV, tuberculosis, and we've seen and witnessed a rise in communicable diseases such as cancer, among other major causes, as raising a major cause of concern. Equally, I cannot stand by these stats, but we have been led to believe that we appear to be experiencing a new pandemic in road accidents, particularly in Harare, caused by many of you who are here. With approximately 139 accidents reported daily, claiming 5 to 6 deaths per day. And according to statistics from the Traffic Safety Council of Zimbabwe, between January and May this year alone, there was a total of 21,183 accidents that were reported, resulting in 860 deaths and injuries. Within the private sector itself and the private medical aid societies, I'm told by ROCA that there is a total of 46 medical aid societies that is scrambling and fighting for about 1.6 million customers, which of course accounts for about 10% of the total population. And approximately 35% of most clients who are covered do not seek treatment due to the lack of finances. It also means that approximately 90% of the entire country suffers from no cover. For those who are covered, it appears there is a complete breakdown of trust between medical aid societies, doctors, and other service providers because of what is commonly referred to as what? Shortfalls. Whether covered or not, you will suffer a shortfall. And it depends on whether you claim it or you don't claim it. But ultimately, a shortfall is a result of breakdown of trust between those who are providing the service and those who are receiving it. And by comparison, because of this dysfunction, there are more people who are prepared to plan for their death than those who are prepared to plan for their lives. There are more people with myriads of policies in this room than those with medical aid. Something is wrong and something is not right. In 2023, the Ministry of Health and Child Care budget allocated about 70% of its budget to curative services, which cover all the expenses related to treatment services, directly funding all healthcare posts, including rural healthcare and central hospitals. Zimbabwe's household out-of-pocket, what is called OOP, expenditure is about 21.24%, the highest in the region, compared to our colleagues in South Africa at 7.5%, our colleagues in Botswana at 5%, in Zambia at about 12.2%. And yes, one, as I referred to earlier, attributes this high OOP to low health insurance coverage in the country and the high cost of healthcare service. As I conclude, I wanted to say, without a doubt, the state of the private health insurance is in serious need of review, Minister. Collectively, all players in the sector need to work together to improve on the confidence as far as the public views medical aid, not as a luxury of the elite, and not as a product of the employed, but also something that can be reached by the unemployed. We need to break the cycle of exclusivity in which medical aid is not only for those in the cities, but something that can be accessed by those in the rural areas. Together, private sector and the government and the public sector, we need to make sure that we look at how we can equally improve the public health insurance through improvements at business, by addressing divergent political and stakeholder interests to increase the reach of quality healthcare to the majority of Zimbabweans. The private sector only covers so much. Business needs to make sure that it covers a substantial amount of civil servants. As we have done with financial inclusion, Honorable Minister, we need to be as vocal in medical inclusion. We need to make sure that we are singing on the top of our voices that there should be nobody who is excluded from what is their constitutional right. Yes, you as the citizens and as the government have spoken. We as Salutem have listened and we have heard you. This is why, as Mahima said earlier, we are bringing to you a solution which we believe will turn the healthcare sector on its head. And in this country, we believe that the solution that we're about to bring you is a much needed one. With your help and your support, today we want to start on a journey of addressing some of these challenges that I have mentioned. In the Salutem, we envision a healthcare system that is both innovative and accessible, and our goal is to create solutions that truly meet the needs of each and every Zimbabwean. Honorable Minister, and all our invited guests, thank you for coming to bear witness to our vision of the future of healthcare in the country, and something that we believe will benefit you, something that we believe will benefit your children and your children's children. I do not want to steal the thunder from our Managing Director, Mr. Rukanyoka, who will shortly unveil some of the Salutem solutions which we hope will start the conversation at a national level on how and on how we can partner together to create an equitable healthcare reform for all, in line with the National Development Strategy and in line with the President's Vision 2030 agenda. Together, let us check some trees. I thank you.